Welcome. You've tuned in for another deep dive, and today we're taking a closer look at something called sterile nodular and granulomatous dermatosis.
Yeah, sounds complicated, but we'll break it down.
Definitely. We've got a veterinary reference here full of info on these conditions, basically diseases showing up as like firm bumps or raised patches, nodules, or plaques on or under the skin.
Right. And our job today really is to get the basics.
Exactly. What causes this stuff, how it's diagnosed, what might happen, but, keep it understandable.
Without getting lost in the jargon.
For sure. And what's kind of amazing is how many different underlying problems can look pretty similar on the outside, just as these bumps.
That's so true. And when we talk about sterile nodular and granulomatous, well, sterile is key.
Meaning no active infection.
Precisely. It's not bacteria or fungus causing it directly. The nodular and granulomatous part that describes how the body is reacting.
So the immune system is involved.
Deeply. It's an infiltration of inflammatory cells, often deep in the skin, the dermis, or even the fat layer underneath, the subcutis.
And a granuloma is like a little cluster of those
Well,
cells.
kind of, yeah. An organized collection of immune cells trying to wall something off or deal with inflammation.
So the body's own defenses are actually creating these bumps we see.
That's the core idea. And the main system affected, as you'd expect, is the skin. Also, the exocrine system, glands, basically.
Our source mentions these can affect pretty much any animal, right? Age, breed, sex, doesn't necessarily matter.
Generally, yes. But, and this is interesting, there are definitely some breed predispositions mentioned.
Ah, okay. Like what?
Well, the text brings up histiocytic sarcoma, which is a serious one, and it's complex genetics in Bernese mountain dogs.
Hmm.
Then you've got collagenous nevi, these other kinds of nodules seen more in younger German Shepherds,
Younger, okay.
and calcinosis circumscripta, often in German Shepherds under 2. Also, eosinophilic granuloma, which seems to pop up more in male Siberian Huskies, usually before they hit 3 years old.
Huh. Those breed links are fascinating. It gives you clues, maybe genetic ones.
Exactly. It suggests there's something deeper going on biologically in those specific breeds.
So what actually starts this whole process? What kicks off these bumps forming? Sounds like it could be a lot of things.
Oh, it really is. The source material lays out a pretty broad range of potential causes. It really drives home how different pathways can lead to a similar look on the skin.
Okay, like what sort of categories are we talking about?
Well, there are immune-related triggers, things like idiopathic sterile granuloma and pyogranuloma idiopathic, meaning we don't know the exact cause.
Right, the mystery ones.
And different types of histiocytosis. Some are reactive, some are malignant, unfortunately. Canine eosinophilic granuloma fits here too.
Okay, immune stuff makes sense given the inflammation. But that's not all. You mentioned other categories.
No, not at all. There are also what the text calls depositional causes.
Depositional, like things building up.
Exactly. Think amyloidosis, where abnormal proteins collect. Or calcinosis cutis and circumscripta, that's calcium deposits.
Calcium in the skin. Wow.
Yeah. And cutaneous xanthoma, which involves lipids, basically fats, building up.
Okay, proteins, calcium, fats, and then there are foreign bodies, right. I can imagine that happening easily.
Definitely. The text gives examples: concrete dust, even fiberglass.
Yeah.
Or sometimes just hair, especially for bigger dogs lying on hard surfaces. The body reacts strongly to try and get rid of it or wall it off.
Makes sense.
The list also includes other things like spherulocytosis, that's about abnormal red blood cells, and sterile nodular paniculitis, which is inflammation of the fat layer under the skin.
Caniculitis, okay.
And those collagenous nevi we mentioned earlier, it's quite a mix.
It really is. Does the source mention specific risk factors that might make some of these more likely?
It does. For instance, high doses of glucocorticosteroids are a known risk for calcinosis cutis.
Ah, a side effect of medication.
Right. And maybe vitamin E deficiency for paniculitis. For cutaneous xanthoma, high-fat diets or underlying conditions like diabetes or hyperlipidemia can be risk factors.
So, diet, medications, underlying health, lots of potential connections.
Absolutely. A lot of different things can unfortunately end up showing themselves in the skin like this.
Okay, so with all these possibilities, how on earth do vets actually figure out what's going on when they see these nodules?
That's the million-dollar question, isn't it? Diagnosis is key. And the very first step, as the text really hammers home, is distinguishing these sterile conditions from infections.
Like deep bacterial or fungal problems?
Exactly, because the treatment is completely different. You also need to rule out skin cancer.
Right, absolutely critical distinctions. So where do they start?
The cornerstone almost always is a skin biopsy,
Taking a small sample of the bump,
taking a piece of the tissue itself. Then comes histopathology.
looking at it under the microscope.
Precisely. To see the cells, how they're arranged, what kind of inflammation pattern is there. It's like architectural plans for the bump.
Okay.
And usually at the same time, they'll do deep tissue cultures from that biopsy sample
To double check for those infections.
to be absolutely sure there are no bacteria, fungi, or other microbes hiding in there.
Makes sense. What about those histiocytosis conditions you mentioned? Are there special tests?
There are. Immunohistochemistry is really useful here. It uses special stains that stick to specific proteins on the immune cells, the histiocytes.
Ah, like tagging them?
Kinda, yeah. It helps tell the different types apart, reactive versus malignant, for example. And the text notes that using fresh frozen tissue for this test works best to preserve those protein tags.
Good tip. Anything else? PCR.
PCR can be helpful too, yeah. It looks for the DNA or RNA of specific bugs, so it can help rule out things like leishmaniasis or certain mycobacteria if there's a suspicion.
So it's not just about the skin sample itself. What about, like, blood tests?
Oh, yeah. Blood work and other general tests are important pieces of the puzzle.
Like a CBC,
Yeah.
chemistry, or analysis?
All of those. They give clues about the animal's overall health. For instance, sometimes with malignant histiocytosis, you might see really low counts of all blood cells pancytopenia.
Okay, that's a red flag.
Definitely. Or with calcinosis cutis, the blood work might show changes suggesting high levels of steroids in the body, maybe from Cushing's disease or medication.
Gotcha.
And with those fatty bumps, the xanthomas, you might find high glucose or lipid levels. The source even mentions a protein called serum ferritin, potentially being high in malignant histiocytosis, but not the reactive kind.
So many little clues to follow.
It really is like detective work.
Does imaging play a role? X-rays or ultrasound?
It can, absolutely. Radiology, X-rays, and ultrasound can help see if internal organs are involved.
Which happens with some of these.
Yes, like with amyloidosis or histiocytosis, you might see changes in the spleen or liver. For calcinosis cutis, X-rays might even show calcium deposits elsewhere in the body.
Wow.
Ultrasound can also sometimes spot underlying issues, like certain tumors, kidney or uterine tumors have been linked with collagenous nevi in German Shepherds sometimes, or changes in the adrenal glands with calcinosis cutis.
So it connects the skin issue to potential internal problems.
Mm.
But going back to the biopsy, that seems absolutely central.
It is. Getting a good biopsy sample is crucial. The text really emphasizes this.
And what makes a good sample?
Ideally, an excisional biopsy, meaning removing the whole nodule if possible, and taking it from an early intact nodule, one that hasn't burst open or gotten super secondarily infected yet.
Okay, get it before it gets too messy.
Exactly. And another key point. If you need cultures, take them from the tissue itself, not just any goo or exudae coming out.
Why is that?
Because the actual culprits, especially fungi or mycobacteria, might be deep within the tissue, and you could miss them if you just swab the surface. Special stains on the tissue slide can also help spot infectious agents.
Right. Dig deep. Okay, so we've covered what these are, the potential causes, how vets diagnose them. Let's dive into what they actually look like under the microscope. What are some key pathological findings?
This is where the specific patterns emerge. For amyloidosis, the pathologist sees these characteristic amorphous eosinophilic deposits. Sounds technical, but they have a special property. They stain apple green with Congo red stain under polarized light. It's quite specific.
Apple green, okay. Memorable. What about a foreign body reaction?
That can look different depending on what it is and how long it's been there. It might be very pus-filled suppurative, or more like that granulomatous reaction we talked about, the body trying to wall it off. Pyogranulomatous means a mix of pus cells and those organized granuloma cells.
Okay. And the idiopathic ones, the sterile granulomas.
Here's the tricky part. Microscopically, they can look very similar to an infectious nodule. The inflammation pattern mimics infection.
So how do they tell?
That's where those negative cultures are essential. The microscope says, looks like infection, but the culture says, nope, nothing growing. That combination points towards idiopathic sterile granuloma or pyogranuloma.
Putting the pieces together. What about the calcium ones?
Calcinosis cutis shows diffuse calcium deposition, basically calcium sprinkled throughout the skin layers. Calcinosis circumscripta, on the other hand, has focal to multifocal deposits, meaning distinct clumps of mineral in specific spots.
Diffuse versus clumpy. Got it. And reactive histiocytosis.
That has a very specific look. The histiocytes, those immune cells, are clustered tightly around blood vessels. The text calls it a markedly angiocentric infiltrate. Importantly, they don't form those organized granulomas.
So location matters. Around the vessels.
Yes, and that pattern helps distinguish it from the really nasty one.
Malignant histiocytosis.
Right. Under the scope, that looks like a dense pleomorphic cell proliferation. Basically, lots of crowded cells that look very abnormal and varied in shape and size, and they're dividing rapidly.
Sounds ominous.
It is. Then there's sterile nodular paniculitis inflammation down in the fat layer, sometimes damaging the fat cells. Collagenous nevi can be subtle, just showing focal dermal thickening of normal collagen bundles. The structure is there, just more of it in one spot.
That's subtle. Okay.
And finally, cutaneous xanthoma features large, foamy macrophages. These are immune cells packed full of lipids they've gobbled up, making them look foamy or bubbly.
It really is amazing how varied the microscopic picture is, even if the bumps look similar at first glance. So once that diagnosis is pinned down, what can be done? What are the treatment approaches?
Well, treatment really depends entirely on the specific diagnosis, the underlying cause.
Naturally.
The text mentions some general care first. If nodules are ulcerated or draining, gentle cleaning or bathing can help. But interestingly, it says activity restriction usually isn't needed.
Okay. Any dietary things?
Yes, for cutaneous xanthoma, tackling the lipid issue often involves putting the animal on a low-fat diet. That's a key part of management.
Right. Treat the cause. What about specifics for some of the others we discussed?
Foreign bodies.
If it's a foreign body reaction, step one is removal, if possible, getting the splinter or whatever it is out, plus supportive care for the inflammation.
Makes sense. And the idiopathic sterile ones?
For idiopathic sterile granuloma or pyogranuloma, since it's an immune overreaction, the first line is often an immunosuppressant, like prednisolone, a steroid.
To calm the immune system down. Exactly. For long-term control, vets might try to transition to other drugs like azathioprine or cyclosporine, steroid-sparing agents to minimize steroid side effects.
Okay, calcinosis cutis, the diffuse calcium.
That requires tackling the underlying cause, if there is one, like treating Cushing's disease. Antibiotics are often needed for secondary infections, and sometimes topical DMSO is used carefully on the skin lesions.
And the clumpy calcium, calcinosis circumscripta.
That's often treated by surgically cutting out the mineral deposits.
Surgical removal.
Ah.
What about the really serious one, malignant histiocytosis?
Unfortunately, the options are limited and often not very successful long-term. The text mentions a chemotherapy drug, lomustine, showing some temporary benefit in some cases, but the overall prognosis is generally poor.
That's tough. And the xanthomas, besides diet.
Treatment really focuses on identifying and managing the underlying metabolic problem, the diabetes, the hyperlipidemia, whatever is causing the fat buildup.
So always back to the root cause. And you mentioned being careful with immunosuppressants if there's also bacteria.
Yes, that's a super important point the text makes. Using steroids or other immune-suppressing drugs when there's an active bacterial infection present needs extreme caution or should be avoided until the infection is controlled. You don't want to lower the defenses when they're needed to fight bacteria.
Right. Don't pour fuel on the fire.
Yeah.
So it sounds like for quite a few of these, it might involve long-term treatment or management.
Very often, yes, especially the idiopathic immune-mediated ones.
So what are the important considerations for those patients on long-term therapy?
Regular monitoring is absolutely key if an animal is on long-term immunosuppressants.
Like checkups.
Yeah. The test recommends blood tests, CBC, chemistry plus urinalysis, and even urine cultures maybe every 6 months or so. This is to watch for side effects of the drugs or any new problems cropping up.
Like what kind of problems?
Well, suppressing the immune system long-term can, unfortunately, make the animal more susceptible to other infections or skin issues. It's a balancing act.
And critically, what about the prognosis, the outlook? It sounds like it varies a lot.
It varies hugely. The text is quite clear that some of these conditions carry a very poor prognosis.
Which one specifically?
Malignant histiocytosis, systemic amyloidosis, collagenous nevi associated with kidney tumors in German Shepherds, and systemic reactive histiocytosis are listed as being almost always fatal.
Wow, that's sobering.
It is. And for many others, like the idiopathic sterile granulomas or paniculitis, the prognosis is often described as guarded. Meaning that while treatment might control the signs, it often requires lifelong therapy, flare-ups can happen, and achieving a complete permanent cure might be difficult or unlikely.
So managing expectations is
Very important for everyone involved.
Okay. So wrapping this up, This deep dive really shows that sterile nodular and granulomatous dermatosis aren't just one thing. It's a whole umbrella term.
Exactly. A diverse group of conditions hiding under the description of bumps on the skin. The causes are all over the map, and as we just heard, the outcomes can be drastically different.
It just highlights how critical getting that accurate diagnosis is. You have to know what you're dealing with underneath that bump.
Couldn't agree more. The treatment and prognosis hinge on it.
It really gets you thinking, doesn't it? You see this wide range of causes, tiny bits of grit, internal fat problems, immune system mix-ups, all leading to skin bumps. It makes you wonder, what other seemingly simple external signs might actually point to really complex things going on inside the body?
That's a great point. It's all interconnected, isn't it? The skin often reflects internal health in surprising ways.
It really does. Well, thanks for exploring this complex topic with me today.
My pleasure. Always fascinating to unravel these medical mysteries.